I'm Dr. Nick Leisure. I'm the Program Director of the Hematology Oncology Fellowship Program at Reading Hospital. The fellowship program is a 3-year program. Presently, there are 2 fellows each year for a total of 6 fellows. For the past 4 years, we've had a combination program in collaboration with Thomas Jefferson Hospital, where the fellows have spent time both here and at Thomas Jefferson Hospital. So it allows our fellows to have the opportunity to get the advantages of the training programs both here in Reading and at Jefferson in Philadelphia. We feel there is a unique educational opportunity at Reading Hospital. We have a wide range of patients demographically and also diagnosis-wise. We also have the power of the Tower Health system, which is 5 affiliated hospitals. So we have a wide range of patients. We see not only primary care referrals from the community, but we also get tertiary care referrals from the surrounding hospitals. When you combine that with the tertiary care experience at Jefferson, we think we have a unique program. We have all the latest facilities and opportunities and educational opportunities as well. And we have an active surgical program with over 1,500 new cases of oncology diagnosis each year and over 1,000 new referrals each year of hematology cases. We have over 25 tumor boards and tumor conferences each month that are multidisciplinary and attended not only by the oncology department, but the surgery department. We also have multidisciplinary clinics where we see a large number of patients. The most common oncologic diagnoses all have not only weekly tumor conferences, but weekly clinics that follow the tumor conference. So typically we would present the patients in the multidisciplinary clinic and then see the patients afterwards to decide on their testing and their care. You have many research opportunities during your fellowship. In fact, there is a mandated research, there will be a required research project. We anticipate that the research would start during the first year. There will be time set aside in both the first and the second year, not only for clinical work, but specifically for research. The third year then is a lot more elective time and research time, so there will be clinical responsibilities, but a lot more time to complete the research. We also collaborate with some of the tertiary care centers in Philadelphia and some of these research projects. We're very fortunate geographically, so we're far enough away from Philadelphia that we can function autonomously. Our patients don't necessarily go there, but Philadelphia and the Washington area and New York to a lesser degree are all major medical education centers. So it's very nice to be close to those centers. We collaborate with physicians in those centers, particularly in the oncology and the hematology world. So it's an ideal situation to be close to the center of what's happening in the hematology oncology world, but also far enough away that we're not having our patients taken away from us. You can expect to be in work at a busy oncology practice. We historically have been a very busy community oncology practice. We are evolving and growing into an academic medical center. You get the benefit of both. You get to see what an active primary practice would look like, but I think that you're also going to see more of an academic approach. It's critical for the fellows not to only get the viewpoint of the physicians that they're working with, but also physicians in other disciplines to learn important parts of surgical oncology, to learn radiation oncology, to learn palliative care. So not only are there formal rotations in those departments, but there's informal interaction with those physicians on a regular basis. So we're very proud of the faculty that we've been able to recruit. We have an active mentorship program, so each of the fellows that come will be assigned a mentor. So typically the fellow would start out being fairly autonomous with the patient, but supervised. And over the period of several years, you'd become more independent. The long-term goal, of course, is to come out at the end of 3 years as a medical oncologist and hematologist. So the McGlynn Cancer Center is a wonderful place to work. It was built as a building, but in a response to trying to bring the oncology community together all in one place. So there's everything that was functioning and interacting with the patients, but kind of off in different areas, now are all under one large, beautiful roof. You know, we can train the fellows to give chemotherapy. We can train the fellows with the science behind all of these things. But there's more to becoming a physician than just that. Information is readily available. Anybody can get it. So the best physicians are the physicians that can not only use those tools, but also cultivate the personal side of taking care of patients to help them through the process. One of the reasons that many of us went into medical oncology is that the patients are appreciative of it. That really to go from that moment of sheer terror and desperation and to be there to be able to help those folks is tremendously rewarding.